Now we are discussing a very important topic, and basically it encompasses a few important points which we need to remember. It's given in U word also. So the disease is basically systemic sclerosis. It is of two types: limited cutaneous and diffuse cutaneous. The limited cutaneous one, you first need to know is that the limited thing has a good prognosis, whereas the diffuse thing, the more the spread of the disease, more the worse of prognosis. So the limited cutaneous systemic sclerosis involves the thickening of the skin of the head and the distal upper extremities, for example hands, and the diffuse cutaneous involves the trunk and the upper extremities. When we come to the limited type, there are more vascular manifestations. For example, the Raynaud phenomenon, that is the change in the color of the tips of the fingers on response to the cold or any stressful situation. There are cutaneous telangiectasias. For example, telangiectasia is a dilation of the blood vessel on the surface of the skin. The pulmonary hypertension can occur. In the limited type, there is Crest syndrome. And when we talk about the diffuse cutaneous type, there is more internal organ involvement. That is how it is associated with worse prognosis. So there is sclerodermal renal crisis, myocardial ischemia and fibrosis, as well as in interstitial lung disease also. The antibodies which are involved in the limited type are anti-centromere antibodies. We need to remember these. These are very confusing. And in case of the diffuse cutaneous type, the antibodies involved are anti-SCL70, anti-topoisomerase 1, and anti-RNA polymerase 3. As you all know that the limited is associated with good prognosis, whereas the diffuse is associated with the worst prognosis. That's all for today.